Hello everyone, welcome to our presentation on cystitis and UTIs. Presenting today will be Jimena Ramirez, Gurpreet Atwal, and myself, Alyssa Armstrong. As we go through this presentation, Jimena will describe what cystitis and UTIs are, the signs and symptoms of a UTI, as well as factors that put people at higher risk for getting a UTI. And then Gurpreet will discuss the UTI treatment and some measures we can all take to prevent getting a UTI. And then lastly, I will be discussing local community health resources available and the goals of Healthy People 2020.
Hello everyone, my name is Jimena. First, I want to say that UTI stands for urinary tract infection. Before we discuss anything, I want to go over what makes the urinary tract system. Now, as this picture shows, the urinary tract consists of your kidneys, ureters, bladder, and your urethra. The ureters carry the urine into the bladder is where your urine is stored, and the urethra is what carries the urine out of the body. Anatomy for the urinary tract is very similar between males and females. The only difference is that females have a much shorter urethra, which increases the risk of developing a UTI. So what exactly is a UTI and what causes it? A UTI is an infection that can affect any part of your urinary system. UTIs typically occur when bacteria enter the urinary tract through the urethra and multiply in the bladder. Most commonly, these bacteria come from the digestive tract through fecal matter. If the bacteria causes an infection in your urethra or bladder, it is referred to as a lower UTI. Now, cystitis is the medical term used to specifically refer to an infection in the bladder. Lower UTIs are very common and easily treatable, however, they can become serious if ignored. If the infection is left untreated, it can become an upper urinary tract infection, which means the infection traveled to your kidneys. This is more serious because it can cause acute renal failure. Both men and women can get UTIs, but again, due to having a shorter urethra, women are more prone to getting one. In fact, approximately 20 to 25% of women have a UTI sometime during their lifetime. One of the most common symptoms of a UTI is a frequent and urgent need to pee. You might feel like you need to pee all the time, even if you just went. And when you do pee, it's usually small amounts of urine. Other UTI symptoms include pain or burning when you pee, bad smelling or cloudy urine, urine that appears red, bright pink, or cola-colored, which is a sign of blood in the urine. Also, you might feel soreness, pressure, or cramps in your lower belly, back, or sides. If the infection goes to your kidneys, your UTI symptoms may also include pain in your back, fever, chills, and sometimes nausea and vomiting. If you have any of these symptoms, tell your doctor right away, as acute renal failure can become a serious complication. Some people are at higher risk of getting a UTI. As I previously mentioned, UTIs are more common in females because their urethras are shorter and closer to the rectum, which makes it easier for bacteria to enter the urinary tract. Other risk factors specific to women include certain types of birth control. Women who use diaphragms for birth control may be at higher risk, as well as women who use spermicidal agents. Also, menopause. After menopause, a decline in circulating estrogen causes changes in the urinary tract that makes you more vulnerable to infection. UTIs are more common during pregnancy because as the uterus grows, its increased weight can block the drainage of urine from the bladder, causing an infection. After pregnancy, if your urethral damage was made, there is higher risk for bacteria to be introduced into your urinary tract system as well. You are also more likely to get a UTI if you've had a UTI before, if you have kidney stones or other obstructions in your urinary tract, if you practice poor hygiene, and if you have a decreased frequency for urinating. Not peeing frequently allows the bacteria to grow in the bladder. This is also why the elderly have an increased risk for UTIs. Their bladder muscle weakens, causing urine retention and thus increasing the risk for bacteria to grow since it's not being flushed. Other factors that can increase the risk of UTIs include diabetes and other diseases that impair the immune system, catheterization, mainly if the insertion isn't done with sterile technique, And lastly, but most commonly, sexual activity. I want to mention that although UTIs aren't spread from one person to another like STDs, having sex can lead to or worsen UTIs. But you don't have to have sex to get a UTI. Remember, anything that brings bacteria in contact with your urethra can cause a UTI.
Hi, my name is Gurpreet Atwal, and today I will be discussing about the treatment of urinary tract infections. So the very first thing to do is go to the clinic or the hospital to get proper treatment and give urine sample so doctor can identify what bacteria is it and what he or she is treating for. Then the doctor will prescribe antibiotics according to that specific bacteria. It is very important to follow throughout the whole treatment process because you don't want the infections to get worse or return back. The length of the treatment and the type of antibiotics, it all depends on the specific bacteria which is causing this infection and the underlying condition of the patient. If the pain is become intolerable and infections is severe, the patient might has to be hospitalized because that means like there is a spread of infection through other organs too, like bladder or kidneys, so they can get a proper treatment at the hospital. If the person is constantly having to deal with the UTIs, that may be the sign of another underlying cause. It's best to check with the doctor to get a proper treatment for that. So after discussing the treatment of urinary tract infections, I am going to talk about some education about it. Education is very important to treat the UTIs, which can include self-care strategies to prevent the reoccurrences. So there's some steps we can take to prevent urinary tract infections. First, it's to increase the fluid intake. So drink like 6 to 8 glasses of water throughout the day will help cleanse your urinary system. Avoid caffeinated drinks and alcohol. They can irritate the bladder. Urinate when you need to. Never hold the urine in. Empty bladder shortly after sexual activity. So urinate before and after the intercourse. This gonna help flush out the bacteria that may have entered the system. Women wipe from front to back. This gonna help to avoid contamination. Also wear cotton undergarments, which gonna help to prevent the skin irritations and stuff. Shower regularly, gently pat dry completely. Also avoid scented hygiene products like sprays, powders in the genital area. These may have a good smell, but some of these products just gonna irritate instead. It is best to use like warm water and the soap to clean out thoroughly. Also, very important is to know the signs and symptoms of urinary tract infections. So, if it occurs, you can immediately report to the healthcare profession. To prevent the reoccurrence of UTIs, understand the treatment. Person needs to know about like the medication name, dose, how to take it, side effects, so they can follow the treatment properly and complete it thoroughly. Also complete the treatment so infection is completely eliminated from the system. It does not return.
Now that we've talked about all there is to know about UTIs, it's important to know where you can go to seek treatment if you feel you've got a UTI. So throughout Stockton, there are multiple locations of community medical centers that are there and dedicated to helping the homeless and the low-income populations. Now, some of those locations are listed here on the slide. And always as a last resort, the hospital is available to help with UTI treatment. As for transportation, the shelter and the gospel mission have been known to sometimes help with a ride to where you need to go, or they can always point you in the right direction and help you find the care you need. The shelter and the gospel mission also are a place where you can shower and women can get feminine hygiene products. And lastly, one of the biggest things you can do to prevent a UTI is to be well hydrated. So where can you find water? The Interfaith Food Bank and the Emergency Food Bank in Stockton will provide you with water, and most restaurants and fast food places provide water for free as well. Healthy People 2020. So every 10 years, this organization puts out a new list of community health guidelines with the goal of improving the lives and health of all people. And Healthy People 2020 is the most recent list. And on that list, one of their goals is for hospitals to lower the number of urinary tract infection cases. And the main thing is that UTIs are preventable, as we've learned throughout this presentation. And you can find more ways of preventing UTIs on the Healthy People website, www.healthypeople.gov. So hopefully with all of this information and raising more awareness on UTIs, we can all reach the Healthy People 2020 goal of lowering the number of urinary tract infections.